This is big and we should talk about it, right? Yet another group of public health organizations has filed a lawsuit to reverse RFK Jr.'s new vaccine guidance that absolutely gutted the recommended childhood schedule of shots. Right as we talked about a few weeks back, you had the CDC changing its guidance so that it no longer recommended that every child receive 6 key immunizations: hepatitis A and B, flu, meningitis, RSV, and rotavirus. It cut the number of recommended childhood vaccines from 17 to 11. And so now, instead of encouraging Americans to give their children life-saving vaccines, you have the CDC guidelines saying that those shots should only be administered to smaller groups of high-risk kids or when a doctor recommends them. And so then, not long after that decision was made, you saw a group of the 6 leading medical organizations amending a lawsuit that they already had against other vaccine changes to include these new updates. And those organizations argued that the changes, they're just not based on any kind of scientific evidence and they'll be incredibly harmful to the public. But you now also have other groups dogpiling on. And this new challenge, it was filed as part of that broader lawsuit and it takes aim at RFK Jr. directly. And so specifically, the suit accuses Kennedy of inappropriately influencing a key vaccine advisory committee called the Advisory Committee on Immunization Practices, or ACIP, by packing it with unqualified experts who share his anti-vaccine views. And in addition to trying to reverse all the recent childhood vaccine schedule changes, the new suit is also asking the court to prevent the current members of ACIP from holding any future meetings, saying that actually under federal law, the committee is required to be fairly balanced and not inappropriately influenced. Right? And with that, arguing that what we're seeing with ACIP, it's anything but that, saying that it's been stacked with RFK Jr. loyalists whose views go against scientific consensus. And so with that, you have the suit citing past statements by recently appointed members questioning the validity of vaccines, and the complaint also alleging, based on unspecified information and belief, that only Republicans and independents were considered as members of the committee. And then going on to note that more than half of the committee members have public views that align with RFK Jr.'s. Meanwhile, I also gotta say, as all this is going down, you have experts saying that the US is also now at risk of losing its measles elimination status in the coming months. But according to reports, today marks 1 year to the day that the strain of measles that caused a massive outbreak in West Texas was first detected. And in these 12 months that followed, the United States has witnessed its worst year for measles in decades. By the end of 2025, more than 2,200 cases had been confirmed. That's the highest number reported in the United States in 33 years. And those outbreaks, they also brought the first measles deaths in over a decade, taking the lives of 2 unvaccinated children in Texas and 1 unvaccinated adult in New Mexico. And now, a year later, the virus is continuing to circulate, with outbreaks currently ongoing in Utah and South Carolina. Right? And those new outbreaks, they have the potential to end America's measles elimination status, a designation that's given by a panel of international experts at the UN to countries that have not had a continuous spread of measles for over a year. That is a public health achievement that the United States fought fiercely for. And we won that status in 2000 after a nearly 4-decade-long campaign to promote the measles vaccine, and we've maintained it every year since. But then boom, RFK Jr.'s first year in office could also be the first year we lose that status. And that's because in order to keep the status, the United States needs to prove that the same strain of measles that caused the outbreaks last January didn't continue to spread for a full year. This status, while it's largely symbolic in practice, you have experts noting that it is still incredibly significant because it is a real, tangible piece of evidence that shows the impact of sliding vaccination rates. But also with this, I've got to note that, Kennedy's efforts to fuck up childhood immunizations, it goes beyond the United States. Because you now have the Washington Post reporting that a controversial infant vaccine trial in Africa backed by RFK Jr., it's set to proceed despite widespread backlash from the medical community. Because you see, according to reports, last month, the CDC gave researchers at the University of Southern Denmark's Bandem Health Project a $1.6 million grant to conduct a study on the health effects of hepatitis B vaccine dose timing using around 14,000 infants in Guinea-Bissau. And with this, you had the researchers saying that as part of their study, some infants will be given a Hep B shot at birth while others won't receive it until they're 6 weeks old. But then the researchers tracking participants over 5 years to document early life mortality, morbidity, and long-term developmental outcomes. Now, a big thing, Hep B is relatively common in the country, and while their current policy is to give the first immunization at 6 weeks, the nation is set to transition to giving a birth dose. And despite what the United States might now officially recommend, a birth dose is the standard recommended by the World Health Organization, largely because it's widely effective at preventing early transmission. So as a result, you have many critics arguing that it's just unethical to randomize which children will get the recommended treatment and which will get the inferior treatment, even if the country's norms haven't officially shifted yet. Also, others say that the trial, which wasn't approved by ethics boards in either the United States or Denmark, could risk exploiting a vulnerable group of people who have limited access to the Hep B shot because of the country's poor vaccine infrastructure. And then beyond that, you also have some arguing that there's really not a need for this study, where the Bandem Health Project claims that the trial is filling a gap about the overall health impacts of a Hep B vaccine birth dose. But as one infectious disease expert explained, that the benefits of a birth dose, they're already considered settled science. So the project would intentionally deny some babies a proven and recommended treatment to study a vaccine that's already been proven effective. But then also with this, there's just a lot of confusion, right? You initially had the Africa Centers for Disease Control and Prevention, which is an arm of the African Union, saying last week that the study had actually been canceled. Or you had them citing an undated document attributed to Guinea-Bissau's new government, which was formed after a military coup last year. But then you had a spokesperson for HHS contradicting that and telling reporters that the research is in fact set to proceed. But then also, as we're talking about this, we should talk about how it's not just vaccine recommendations that RFK Jr. is trying to change.